But at this point, what I'd like to do is hand over to the Honourable Jillian Skinner, who is our Minister for Health and Medical Research.
Thank you very much indeed, Rowan. May I start by acknowledging the traditional owners of the land, pay my respect to elders past and present, and particularly any in the room today. I also wish to acknowledge my parliamentary colleague, the Honourable Kevin Humphries, Director General Mary Foley, board chairs, board members, as well as chief executives and other staff from the local health districts, representatives of the pillars, of Medicare locals, of medical colleges and universities, and many other organisations. It took a while for me to walk from the stairs to here because there were so many fantastic people that I wanted to say hello to. So hello to all of those I haven't met, and thank you very much, all of you, for coming. I think it's absolutely wonderful to see so many people here today, and it's such a great pleasure for me to join with you in the second New South Wales Health Symposium. I well remember the energy and ideas that you brought to last year's inaugural forum, which really was focusing on funding reform. This year's theme is improving patient care, and there can be nothing more important to what we do. But while I might focus on what we've done in the past, really it's time to look forward, and it's time to think boldly. We have a strong hospital system, 236 hospitals and other health services in the state, in which we know that patients receive high quality care. Now is the time to broaden our thinking, to evolve by harnessing new ideas and new technologies, to strive to deliver the right care in the right place at the right time. We cannot continue to see acute hospitals as the absolute centre of our health system. Everyone I talk to, and this, by the way, is right across the country, but also overseas, talks about the importance of devolution, and some are talking about it and doing things about it, and I hope that you'll see that we're really doing something about it here. Instead, acute hospitals must become a key part of a network of services that provide more appropriate health settings to serve the diverse and growing needs of the people of New South Wales. In short, we must reform the way we work to meet changing demographic needs and demands. So how can we do this? We can do this by building closer links from the New South Wales hospital system to community health, to GPs and medical locals, then to the community. We can do it through further devolution, ensuring decision-making is made locally, where local clinicians and managers are best placed to implement changes to serve the particular needs of their communities. We can do this through a whole of hospital approach by acknowledging and understanding and working on a situation where emergency department blockages, for example, are not necessarily about problems in the emergency department. Their problems are relating to patient pathway issues. We need to address, we can do better things by integration of services across acute and primary settings, but acute to subacute and even medi-hotels, this hub and spoke model. We can do it by better collaboration through all health providers, including not-for-profit and private, but also other government agencies, such as Department of Community Services, Aboriginal Affairs, and we're already doing some work in that space. And just going back to the not-for-profit and private sector, you will know that we announced that we were seeking expressions of interest from the not-for-profit and private sectors to build the new Northern Beaches Hospital, and I'm very pleased to advise you that the industry briefing, which was held yesterday, was standing room only by many genuinely interested parties, not just observers. So, and the response has been absolutely fantastic. A very good example of thinking outside the square. We can do more through new models of care, hospital in the home, ambulatory care. And let me give you 3 examples of some of the great work I have seen in this regard. At Orange Hospital, the structured interdisciplinary bedside rounds program, or SEBA, I was blown away by this, and I know it's true in other hospitals, but where you had in a medical ward senior clinicians on a rotational basis doing rounds with the nurses, with the pharmacists, with the junior doctors, the students, and everyone involved in the patient care, including the patient and the patient's family, twice a day. So that the outcome of that was a shorter length of stay, fewer readmissions, unexpected readmissions, and really importantly, fewer buzzers ringing through the day. A real telling point as to how patients regarded that program. At Hornsby Hospital, the GRACE program, a program which, again, in many other hospitals is focusing on geriatric care, keeping older people who are residents of aged care facilities out of unnecessary attendance at emergency departments. And then at a number of hospitals, including Wyong and Fairfield, where I was just last week, ambulatory paediatric care, where when I was at Wyong and sitting around a table with heads of the departments there, the NUM from the paediatric ward there told me a year ago, and again just recently, when we're talking about wish lists, please don't give me any paediatric beds. We do better by treating our patients as ambulatory patients with a wonderful support of the emergency department and others in the hospital. These are new models of care that are really transforming the way we do business and, I think, improving patient care. We need to harness emerging technologies and health informatics, understanding what we understand through research perhaps, or through new models of care, how we can best treat patients to get a better patient outcome, but also to most usefully use our resources. We need to value research. As you know, I believe research is not just an afterthought. I am the Minister for Medical Research, proudly so, as the Minister for Health, and I am blown away when I attend research functions where I hear about the wonderful work, particularly the translational work, that is improving patient care. We need to stress prevention by looking at tackling risk factors, and this is an area where we're looking at working across government. The Ministerial Preventive Committee has already had a meeting with the Minister for Planning, for example, and in the new planning white paper there's a reference to health and wellbeing. Those are really important initiatives when we're looking at addressing risk factors. We need to strive to reduce clinical variation, as been said, and I'm sure Brian McCorn will talk about this further, where outcomes for rare and complex surgeries, for example, vary so much, and in more common conditions where we can learn from each other. Treatment of people with cardiac disease, with strokes, and I'm thrilled at the work that ACI is doing in this regard, and the willing participation of specialists and hospital managers in coming to workshops to discuss these issues, and a genuine interest in learning how to do things better. As Health Minister, I am proud of what we are doing in recruiting, rebuilding and reforming health. In the area of recruiting, we've employed 4,000 extra nurses, about 2,000 of them in rural and regional hospitals since coming to office, taking the workforce of the nursing workforce to over 47,500 by headcount, and we have over 900 more doctors, FTE, plus more paramedics. We have a record this year, 925 medical interns employed throughout New South Wales. We're rebuilding by spending nearly $5 billion in rebuilding and investing in new hospitals across the state, and reforming in a myriad of ways, reforming New South Wales Ambulance to improve paramedic response times, eliminating smoking in public places and outdoor areas, increasing organ donation, targeting an 80% reduction in HIV transmission by 2020, increasing access to palliative care across the state, planning for our future health workforce, fine-tuning the intern recruitment position, eliminating bullying from our hospitals, and supporting freedom of association legislation, allowing junior doctors and paramedics to join the union of their choice. We're also proud of the fact that we're trying to and working toward reducing the lifestyle-related risk factors which lead to chronic disease through the establishment of the Office of Preventive Health at Liverpool, and easing the burden of chronic pain through the New South Wales Pain Management Plan to improve quality of life for patients. We're devoting record funding for medical research, more than $200 million this year, to ensure cutting-edge treatments and technologies are utilised in our health system for the benefit of patients. Ladies and gentlemen, New South Wales Health is one of the greatest healthcare providers in the world, I believe. We're rightly proud of what we do, but it is time to be bold. The challenge for each of us in this room is to continue leading the New South Wales health system in the exciting directions which the time demands. I'm with you. I wish you well as you spend today sharing ideas and laying the foundations for the year ahead. Have a fantastic day.